Hello. I think we can make a start. We'll let some minutes go by to allow people to come in, but it's already 4 minutes past 11 here in Central European time. So we can make a start. Welcome to this new session on the advanced webinar series on spatiotemporal modeling of climate-sensitive diseases. The topic of today's webinar is statistical modeling. I am Carlos Milá. I work as a data scientist at the Global Health Resilience Group at the Barcelona Supercomputing Center in Spain. I have a background in statistics and geoinformatics, and I'm here today with my colleague Anya.
Hi, I'm Anya. I'm a postdoc at the Global Health Resilience Group at the Barcelona Supercomputing Center. My background is in vet medicine, but I also have a PhD in epidemiology and a lot of experience in vector-borne diseases.
So that is us. And this is the program that we have for today. We will start with an introduction where we will see the model that you used in a previous installment of this webinar series, which was a linear model. So we will look at this linear model a bit in depth. And then we'll start in the second section. We will start constructing layers on this model to make it more suitable for the disease case data that we're working with. This will include an introduction to generalized linear models, then also some basics of Bayesian inference, as well as hierarchical models. Then in the third section, we will see some model terms that we can introduce in our models to capture spatiotemporal relationships in our data. In the fourth section, we will see how we can use these models for forecasting, adapting them for early warning system. And then we have 10 or 15 minutes at the end for questions, where you will have the chance to ask any questions that you have about the content of today. You can either type your questions in the chat during the webinar or during this time at the end, or you will also have the possibility, if you so wish, to unmute yourself and ask your question live. So let's get started with the linear model. Great. So here in this slide, if you can see my cursor, this is the syntax of the model that you fitted in one of the previous sessions of this webinar. This is a linear model, and we can translate this model syntax into an equation to understand it better. The models that you are fitting here translate into this equation where y is our outcome, which are the disease case counts. And then we have two covariates, rainfall, x1, and temperature, x2. And we have different model coefficients. We have beta 0, which is the intercept, which is our predicted disease cases if rainfall and temperature are both 0. And then we have beta 1 and beta 2, which are the two coefficients of our climate predictors. And we can interpret, for example, beta 2 for temperature as the increase in the disease cases for 1 unit increase in temperature, keeping all else same. This epsilon here, it's zero term, and it's the difference between the fitted and the observed values. So this is the model that you have worked with so far. And before we start expanding it, we would like to go through some of the assumptions that this model has. First, as we have already seen, we're assuming that our predictors are linear because they're introduced into the equation with the summation of the coefficient and the covariate. However, in the last webinar for infectious diseases and climate variables, we saw that some of the climate variables have nonlinear effects on the disease. So we might want to also take that into account, which is something that we cannot do with this linear model. Another assumption is that we have conditional independence of the observations. But our data, as we also saw, are structured in space and in time. So we will have spatiotemporal dependencies in our data that this model is not currently capturing. The third assumption is about the distribution. When we're fitting this model, we are actually making an assumptions on the distributions. So this model translates into these two equations, where we have the response, here y, which is conditional on mu, and mu is a symbol that you will simulate into this presentation. It simply refers to the mean of the cases. And then sigma squared, which is the variance in a normal distribution. So we assume that the cases are conditionally distributed at a normal distribution based on the mean, which is defined by the equation that we have fitted, and then a sigma squared. As some of you might be familiar, the normal distribution is a distribution that has a certain support and characteristics, and we will see in a few slides that it might not be the best choice for the disease count data. So we might want to have another probability distribution that is more suitable, but more on that in a few slides. So in a nutshell, this is the model that you have worked with so far, and there's room for improving that model. And this is what we're going to see today. We might want to add things to this model. For example, we want to add some temporal characteristics of our disease data. For example, we want to introduce seasonality of the diseases, which this model does not reflect, or interannual variation in cases. We'll see how to do that. We can also expand it to include differences in spatial units and then also correlation between spatial units, which this model is not doing at the moment. So we'll also see ways on how we can do that. Also about relationships, this model is linear. We'll see how to incorporate nonlinear relationships. We'll see how to use distributions other than the normal that might be better suited. And then we'll also learn how to use this model for prediction and early warning systems. So I hope you're excited for this. This is the content that we have prepared for today. So let's get started building upon this linear model. So the first extension I would like to present you is about the distribution, the limitations of the normal that I have just mentioned. But now let's go a bit more in depth. So this is the model that we have just seen, that we have so far, where the response conditional on the mean and the standard deviation assumes a normal distribution with this linear predictor. So by assuming a normal here, the normal probably it's a distribution you are very familiar with the bell shape, but the normal distribution has support on all the real numbers, that is both negative and positive. So that means that if we use this model, we could end up having predicted negative cases, which is something that we know it's not realistic. Likewise, we could also end up predicting non-integer cases, which also it's a bit problematic. And another nuanced, a bit more nuanced limitation of that model is the variance. In the normal distribution with this sigma square, we assume that the variance is fixed. But for counts, we know that the variance depends on the mean. Imagine that we have a distribution of counts with mean equal 10. The spread of the distribution will be quite narrow. However, if we have a distribution of counts and the mean is, I don't know, 1 million, the spread will be much larger. This means that the variance of the distribution scales with mean. And this is something that the normal distribution does not do. So in order to have to be able to accommodate other distributions, this is where the generalized linear models come in. Generalized linear models, known in the statistics literature as GLMs, as an abbreviation, are a generalization of a linear model where we will tweak a few things to have possibility of having more choices. This is the two equations that we had before, but changing a few things. The first big change is that here, now we don't have a normal distribution anymore. We have F, which is a placeholder for any distribution in which we call the exponential family. And the exponential family is just a range of distributions, very well-known distributions, such as the normal, the Poisson, the binomial, and the negative binomial. So we have a range of distributions to choose from, not only the normal, but many others now. Rather than having sigma square, now we'll have theta, because this theta is the parameters on the distribution that we will choose. And if the parameters will depending on the distribution that we choose. And then the other element that we will change is here, the link function. The link function is important because it would the function that will link the mean of our cases with the linear predictor, which remains the same. In the normal model, we didn't have anything here. This is what we call an identity link function. But here we extend it and we have G, and we can choose amongst many possibilities of link functions. So what are the best choices for the distribution and the link function? This will depend on the data. And in this case, we have this discount data. So let's see our choices, starting with the distribution. So two distributions that are very used and very suitable for count data are the Poisson and the negative binomial. And why? Because these are distributions that its support is in the integers, positive integers. So this is perfectly aligns with the count data. Then what the distinction between the two, the Poisson and the negative binomial, is in the assumptions. The Poisson distribution assumes that the variance is equal to the mean of the counts. The negative binomial assumes the possibility that the variance might be larger than the mean. This is what we call overdispersion. And for you to understand this difference, I have simulated 1,000 values coming from Poisson and a negative binomial with the same mean equal 10. And we can see them in this histogram. And you see that the spread of the Poisson is much narrower than the spread of the negative binomial. And that means that the negative binomial has allowed us to have a variance that is larger than the mean. This is why it's more spreaded. When modeling disease case counts, overdispersion happens most of the time. So normally would go for a negative binomial distribution. But I just want to let you know that for some cases, Poisson might be fine, just that negative binomial in practice is much more used. So now we have our distribution. We need then to decide the link function. So here I have substituted f for the negative binomial because we're going to use in most cases a negative binomial distribution. But here, as a link function, normally what it's used, it's the natural logarithm function. And why? It's because the log has some very nice properties that we like for count data. The first is that we can go from this equation of the linear predictor to this, just simply by exponentiating the right-hand part. And we see that the mean, as expressed by this equation, will always be positive, which is something very interesting because we know that counts will always be positive. So this is something we like. Another property is that we can express the exponential of a sum as the product of the different components of the exponential. And we can interpret this that this does not mean that our effects are additive anymore. Here, our effects are multiplicative. And this is very interesting because in our case count distribution, we tend to have distributions that are skewed and that have a long tail. And having multiplicative effects will allow us to capture these tails much better than an additive model. So long story short, we will use the logarithm in most of the cases, if not all. Then, however, using a link function has an impact on how we can interpret the coefficients of the model. Now, since our linear predictor is in terms of the log of the mean, we'll have to be careful with an interpretation of beta 1 and beta 2 especially. We can still interpret the sign of the coefficients. If beta 1 for temperature is larger than 0, it will mean that an increase in temperature will lead to an increase in the log mean of the counts, that is, an increase in risk. Likewise, a negative beta 1 would mean a decrease in risk. But interpreting the size of these coefficients, it's tricky because they are expressed in terms of the log, of the natural log of the mean. So one way that we usually interpret them is to interpret the exponentiated version of these coefficients, for example, the exponential of beta 1. And these exponentials can be interpreted as multiplicative effects. For example, if we have an exponentiation of beta 1 equal to 1.1, we can say that for 1 unit increase in temperature, the mean will be multiplied by 1.1. And in these equations, I have just left them here in case some of you are interested to see how this interpretation can be derived from the equations of the linear predictor. The last thing I want to mention about the generalized linear model is the inclusion of what we call a population offset. And the motivation of a population offset is that in our model, we are modeling counts that come from a variety of places and moments in time because our data, again, is structured in space and time. Comparing the crude counts might be tricky because the population at risk at each of these areas and each of these models in time might be different. It might not be fair to compare the disease case count in a city versus a rural area. So what we would like to do is to somehow try to standardize them in our model. And we can do that using the population at risk. So what we want to do is to go from modeling the crude counts to modeling the disease rates. And we'll see how introducing this tiny change, which is a population offset, we can do it in the model we have so far. Here we see again the same equations, but see this change that we have done in the linear predictor equation. Rather than having the log of the mean, now we have the log of the mean divided by the population. So we are modeling the rates. What we do in practice is to move the population from the left hand of the equation to the right hand of the equation, as you see here in the third equation. So it's here as a positive term of the population. So the log of the mean stays the same. This equation until here stays the same as we had before, but we add this term. Note that this term, it doesn't have any coefficients. So it's just something that we introduce into the model, and the impact of intruding this log, this offset, which is the log of the population, makes us move from modeling counts to modeling disease rates. So this is all we wanted to tell you about generalized linear models, specifically apply to disease count data, but drop any questions in the chat and we can go to that later. I think Anya is already responding some of them. Now we'll go on the estimation of those models. There are different ways to estimate GLMs. You can use a frequentist approach, but for early warning systems, we tend to use Bayesian inference. And the nice thing about Bayesian inference is that it allows us to estimate the model parameters while characterizing their uncertainty through their full probability distributions. Here in our model that we have so far, we have that rather than having a point estimate of beta 0, beta 1, and beta 2 plus the standard error, we have the full probability distributions as you can see here displayed in this graph. To do Bayesian inference, we need three main ingredients. First, starting with the prior. We need to assign what we call prior distributions to all the parameters of the model before observing the data. Then we feed the model and the data comes in. And the data comes in via what we call the likelihood, which is how probable the observed data are given the model parameters. What we do is to take the prior and then the likelihood, which contains information in the data, and then update the prior with the data and obtain what we are actually interested in, which is the posterior distribution, which are the updated beliefs about the parameters after having observed the data. So again, what we do is to assign a prior distribution to all of the model parameters before the data. Then the data comes in with the likelihood, we combine it, and we get the posterior. So you might be wondering, because this is like the question that naturally arises at that point, okay, how do we assign prior distributions before having seen the data? So there's a trick there, is that for these kind of models, we tend to assign prior distributions that are weakly informative priors. And by weakly informative, we mean that these are distributions that have very large variability, that they do not contain much information, and then they will let the data dominate in most of the cases. Here I have put an example of what would be a good weakly informative prior for a beta parameter. You see it's centered at 0. So we don't assume any directionality of the effect. It can go either way. And also it's very broad. So it can consider a wide range of possible values for that parameter beta. So we have seen how Bayesian works, so some basic concepts about Bayesian inference, but I haven't actually told you why Bayesian and not frequentist for early warning systems. So we have seen that in Bayesian, as I have said before, we have full probability distributions for all the model parameters. But one very nice thing about Bayesian is that not only do we have the probability distributions for their parameters, we can also have probability distributions for the predictions of the model. This is what we call the posterior predictive distribution. So let's see an example. So for a specific moment in place and time, we do our predictions, but rather than having a single value for that prediction and maybe perhaps a prediction interval, we have a full probability distribution for that one prediction. And since we have this full probability distribution, we can do very nice things. One is to compute uncertainty intervals, what we call credible intervals, quite easy, by taking quantiles of the distribution. In this case, we'd be computing a 90% credible interval on the predictions. We could also produce point estimates if we so wish. In these predictions, for example, we could take the mode, the mean, or the median. Another thing that we can do, which is very useful for early warning systems, as we will see later, is to compute probabilities of the predictions exceeding a certain value. Imagine that we have this distribution for a given prediction. We can actually compute the probability of that prediction being higher. In this case, we'll have 171. That would be a threshold. So we can compute the red area, and that red area would tell us the probability of that prediction being higher than that value. In this case, it would be roughly 30% approximately. So this is a very interesting property that we will see in action during the early warning systems. And now I pass it to Anya.
Okay, so yes. So now imagine a slightly more complicated situation. Say that in addition to having, you collected information on your dengue cases and your temperature and your precipitation at a certain spatial unit. So in this case, it could be like a smaller one, like municipality. In this case, it could be this variable microname, right? And in addition to that, you have this other information that is associated to a larger spatial unit, like a district or a region that your municipality is within. And maybe there's information at this larger spatial level that you're also interested in including in your model, like, this water network or, efficacy of vector control or ecozone or something like that, things that are kind of like these larger groupings. And so you might not really know how to do that in a first pass. Your first instinct might be, well, if I want to include this group level information in my model, maybe I just need to aggregate, average out all my information at my individual level, at my municipality level, so that it's all at the same level, right? But then you would lose so much information, so all this rich information and all this variability within your cases and your temperature that you have at the municipality level. And in this case, for example, you would only have 4 data points, right? Because you only have these 4 larger regions. So that's not ideal. So what other ways are there for including group level information in an individual level model? So some options could be, having an intercept that varies by group or by region in this case. And here I'm just going to make a note that instead of using the beta 0, which was in Carlas's notation, I've been using the alpha, but it's the same. It's the same intercept. What it means is the average value of your outcome. In this case, we can say dengue cases when the other variables are at 0. So in this case, you could say 0 would be the average temperature, right? If you were looking at a scaled temperature variable. So in this case, varying intercepts would mean that the average number of dengue cases that you expect at the average temperature in different regions is different, right? So your baseline dengue is different. Or you could say, okay, I think that the baseline dengue, so the average dengue is going to be the same across all regions, but that the effect of the varying temperature on dengue cases is going to be different in the different regions. So here you would be talking about varying slopes by region, right? So your beta is varying with this J, with this group index. Or you could say, I think that it's all going to be different. I think that the baselines for every region are going to be different and that the effect of temperature on the outcome is going to be different. So the slopes are going to be different. So in this case, you might be varying intercepts and slopes by group, right? And so this might be, for example, what happens in an interaction term is kind of what that is. So in a hierarchical approach, what we are doing is we are allowing for this variation by group in a way that allows information to be shared across groups. And so to explain this, which is called partial pooling means you're sharing information across groups. I'm going to explain what isn't partial pooling. So the other extremes of that, which are complete pooling. So in this case, you're assuming that the groups are all the same and there is no difference across the groups and that they all have the same average, and they all have the same effect. So basically this would be like a linear model, right? Here you have like just one intercept and one slope for the entire study population. Or you could assume no pooling, which is you're saying that each group is completely independent and completely different from the other groups, and they don't have any relationship with each other. There's no shared information. And this would be equivalent, for example, to just fitting a separate linear regression to each group. What you're doing in partial pooling is you are saying, okay, we're going to allow, for example, for the intercept to vary for each group, but we're going to assign a prior to that intercept that is, in this case, a normal distribution. And we're going to say that this normal distribution, the parameters in that distribution are in itself something that we're informed by the whole population. So in this case, we're saying, okay, we're allowing the intercept for each group to vary around the population mean. So here you have like these like little distributions for each group, which are varying around the population mean, which in this case would be mu alpha. And this like variance alpha is just kind of like the entire variance around which these group means can vary. So a visual way to see this or to understand this as well would be, I really like this graph. This helped me understand it when I was studying it. So here you have, in the red line, you have the complete pooling example. So there's no difference between the groups. You're just looking at the average across the entire population. And then on the left, we have the no pooling, which is where every group is like independent from every other group, and the partial pooling where all these groups are sharing some information, right? And so on the x-axis, you have the number of observations within each group. So how many sample, like the sample size for each group. And then on the y-axis, we have the estimated group mean for that group. So this alpha sub j in this case. And so here we can see in the no pooling example that when the group has very few observations, so a small sample size, the estimates for what the average outcome in those groups are very variable, and they have like large standard errors. But if we look at the same groups in the partial pooling example, we see that the standard errors are smaller. So these estimates are a little more accurate, and also that they have been like pulled towards the population mean. So there's a shrinkage towards the population mean. And this is because, if you have little information about a group, I guess your best guess is it's probably going to be around the average of the entire population, right? Which is not a bad guess. However, what we also see is that in groups that have large sample sizes, the difference between no pooling and partial pooling is not that large or none at all. So basically what this is telling us is that there are some advantages to this approach of using hierarchical models. When you have observations that belong to the same group, which might be the same, region or the same season or the same individual, if you're like doing repeat sampling on the same person, there are characteristics of that group that might be driving the way that that group behaves or the outcome of that group will be. So there's some uncertainty or there's some behavior of the outcome that is inherent into being part of that group. And you can capture that using this hierarchical approach. It's also good for when you have imbalance in sampling. So you have some groups with a lot of observations and some groups with not that many observations or smaller sample sizes. Then, this approach helps you estimate, especially in those groups with smaller sample sizes. It helps you, be very explicit as to where variation is coming from, your uncertainty is coming from. Is it coming from, spatial heterogeneity, from temporal heterogeneity? All these things you can like explicitly model that using this multi-level approach. And basically it makes it so that you don't have to do this averaging of your individual level data. You can include group level data into your individual level model in a way that doesn't reduce the richness of your individual level model. So just to recap, what is this hierarchical approach? We're assigning a prior to our group level parameter, and this prior, which is a distribution, has its own parameters, which we call hyperparameters. And those will also need some priors assigned to them, and those will be the hyperpriors. But so there's like this two-level kind of framework where you have like your main thing you want to be modeling, and then within that you have like these group level parameters that you're also assigning a prior to. Okay, so how does this look in practice? What do we use this for a lot? So with these spatial temporal models, there's usually a couple of say uncertainties that we generally want to capture, right? That we want to kind of account for in our model so that the effect of whatever other covariates or whatever other effects we have kind of in that first level of the model are cleaner, right? They're not so noisy because of these other sources of uncertainty. So one of those sources of uncertainty is this interannual variance, right? So, what makes it so that one year has way more dengue than another year. And these might be things that you maybe don't have data on and that you're not including in your model, but that are having an effect on, the dengue counts in a certain year, which might be like, oh, my country had a huge event that year and there was like a lot of people coming in from other countries and there was a lot of transmission and we just had like a huge outbreak. And so maybe there's like some pattern, right? That like, El Niño, La Niña is like creating this multi-year pattern. Like every 3 years you're seeing, a dengue outbreak. Or maybe it's immunity, right? And maybe that's really difficult to have data on and to include in your model. So there are all these things that could be like driving these intraannual patterns that are causing this variation, but that you're maybe not being able to capture explicitly in your model. And with these kind of group level intercepts, you might be able to just account for that uncertainty in that way. So for example, here we included this parameter gamma sub A, which is for annual. And here we're assigning this normal prior to this gamma interannual term. And in this case, that means that we're assuming that the years are independent from each other. And so there's no like correlation, no pattern between them. But you could use other priors that would assume like an interconnectedness between adjacent years, like a random walk 2 or a random walk 1, which I will talk about in a minute. But so basically what we would see if we like actually estimated these annual effects, this gamma A, would be here on the left, this yearly random effect here. And so basically what this is saying is like, oh, some years are above average and some years are below average. And so here, for example, 2007, you see there was a big outbreak. This is the raw time series of the actual data. And you can see that you are capturing with this interannual term that year actually did have a larger than average number of cases. So that's one source of uncertainty that is good to account for. Another one might be seasonality, right? So is there a pattern within a year of certain months that generally have more dengue than others? And is there maybe, a correlation between adjacent months that you can also maybe capture? So for example, here in this data from Brazil, this is also a seasonality plot from the raw data. You see that generally at the beginning of the year, you have a lot of dengue. It kind of tapers down towards June, July, and then in August, it kind of kicks off again. And you can see that very well captured by the seasonality monthly term that we've included in this model. So in this case, here we have our delta M for month. We went for random walk order 1 prior on that parameter. And so what this is doing, it's informing the average number of cases in the current month with the number of cases from the previous month. So, it's not the same being August that was preceded by July than being March that was preceded by February, where there were like way more cases, right? So, you can capture those kinds of correlations. And so lastly, we really like to account for spatial patterns, right? So maybe regional patterns, maybe you have regions that just generally have more dengue cases, and maybe this is due to climate, or maybe it's due to other things, like there's like a huge city there, or there's like a lot of movement there, or there's like a trade hub, or people behave in a certain way there and not in other places. And so there are like all these reasons that could make it so that certain places just have more dengue than others. And another thing that we try to capture with these kinds of terms is the spatial autocorrelation, which you've probably heard about, which is this idea that regions that are close to each other or neighboring each other are more likely to have similar values than regions that are not neighboring each other. So in this tiny little example here, if you have positive autocorrelation, then regions close to each other will have similar values. If you have no autocorrelation, it will just be random. And if you have negative autocorrelation, then different regions will like have opposite, will like be very different from each other, right? And so a model we tend to, or like a prior we tend to use for spatial effects, for capturing the spatial uncertainty, is this BYM2 prior, which is the Bizag-York-Moliere 2, which is so this is a lot of information on this slide, and you don't have to look at it now, but maybe in the future when you want to fit a spatial model, you can come back to it and be like, oh, this is helpful. But so very briefly, what this is doing is it's kind of dividing your spatial effect into a structured spatial effect and an unstructured spatial effect. And the unstructured spatial effect will be, will have a prior that is independent, a normal distribution that's just like independent, and just kind of the noise that is not structured. And the structured spatial effect will be determined by an adjacency matrix and an ICAR model here. Which basically what this is saying, so basically you need to have an adjacency matrix in order to calculate this, which is a matrix that tells you which regions are neighboring which other regions. And all this is saying is that a region, like the average value that you expect for a region is the mean of the values of the neighboring regions of that region. Okay, moving on. So now that we've captured all this uncertainty due to time and to space, how can we further, make our model a little more complex and better able to capture these effects, these climatic effects that we were talking about. So this is like the simplest example that Carlos was talking about before, which is like a linear effect, right? You have your slope. But as we were saying the other day at the other webinar, often these climatic effects aren't linear, right? So how do we capture nonlinearity? So there's several ways to do this. One would be to introduce polynomial terms into your model. So for example, you can introduce a quadratic term. So instead of having just beta temperature, beta 1 temperature, you could have beta 1 temperature and beta 2 temperature squared, and then you would get this curve. Or you could even go crazier and add a cubic term, and then your model would be even more flexible. Or you could be, I want to be super flexible, and you could introduce a spline term. So splines are ways of modeling nonlinearity, which can be very flexible. And I'm going to just give you a brief intuition of how they work. So basically, what they are is they're like a fancy linear regression where what they do is they take the predictor, so in this case your x-axis, and they chop it up into little pieces or chunks. Oh my God. Sorry. I'm sick. So sorry. Wait, actually, maybe
Yeah, I can take over. Sorry, there's the flu season here in Spain. So yeah, and I was taking that splines is another way to take into account nonlinearities in our data, and it works quite different than polynomials. What we do is to divide our prediction space in what we call basis functions, which in a nutshell is what you can see here in the screen. And then this is, as Anya said, a linear combinations of these basis functions, so that we can, by combining these lines that you see here, we can end up with this line. So we'd assign a coefficient to each of these curves, and then we'd combine them to obtain the final curve you can see here on the third row of the screen. And there are many ways we can control how flexible they are, and choosing one or another will depend very much on our data and our modeling choices. What you see here is the knots, which basically influences how many curves we are. The less curves, the less flexible the model will be. The more knots, as you see here, there are 15. This is very flexible, so we can go very weakly. So this is typically the way we use to determine flexibility in our models. So to wrap up today's presentation, we have seen how to incorporate all of these model terms, and now we'll see how to use these models for early warning systems. So again, since I said in this presentation, we're working in a Bayesian context, so that allows us to, rather than predict a point estimate and a standard error, we have the full distribution of the predictions. So with that distribution, the first thing we can do is simply to plot our predictions versus the observed data. Here we have one example of dengue in Barbados, where we have the observed cases in a black line, and then the red is our predictions. We can take a point estimate of that distribution, for example, the mean, that is the bold red line, and then we can build also credible intervals around that mean. The problem of predicting cases is that we need to go from predicting cases, which is a numerical variables defined in the integers. We need to go from that to predict an outbreak. An outbreak is basically binary, is a yes or no. So now we will see how to do it, how we can go from predicting cases to predicting outbreaks. So the first thing that we have to determine is how do we find an outbreak threshold? And this will very much depend on the disease, on the location, and it's something we need to consult with stakeholders, public health agencies, and also civil society organizations who work in the field, even hospitals, to see what's relevant for a disease in a given location. And once we have a possible range of outbreak thresholds that would be likely and suitable for our area, we can also assign data-driven ways to determine that threshold. For example, we could take as a threshold a certain quantile of the observed cases. For example, the 80th or 90th quantile in our case observed case distribution. And our way to do it is take, for example, as a threshold the mean plus 1 or 2 or even 3 standard deviations. So once we have defined the outbreak thresholds, that is the number of cases after which we'll declare an outbreak. One thing that we can quantify thanks to Bayesian inference is the outbreak probability. Remember that again, we have this probability for the predictions. So using these probability curves, we can calculate the probability of that prediction exceeding that threshold. Here we have one example. And we can, imagine we define the outbreak threshold at 171, which would be that red line, we can compute the probability that that prediction in that given moment in space and time is above that outbreak threshold by computing the red area. And this is very important and very nice to be able to quantify uncertainty in our early warning systems. Now, the tricky way is how do we communicate this uncertainty? We saw a bit of that in the last session of the webinar, but we wanted to explain a bit more on that. So what we do is to translate this probability of outbreaks in clear messages. Here we have, again, one example for dengue in Barbados, where we define different ranges depending on the probability of an outbreak in the area, ranging from low to very high. And then we assign color categories that directly link to that risk profile. We also link that very risk profile to specific actions to take in case of the early warning system determined that the risk of the outbreak was one of these 4 categories. And something that you might want to do is using cross-validation methods that we used in the last session of the webinar, is to compare to determine how your early warning system to predict outbreaks works in practice, how much we can trust it. So we can go into the past and compare what our model said versus what actually happened. And this is what we have in this graph here on the right-hand side, where we have 4 different epidemiological seasons on the y-axis and different months. The outbreak probability that our model forecasted, that is categorized into 4 different colors according to the scale that we have here. Then we can see with a cross whether the outbreak actually happened. And we see that in this case, for that particular model, we predicted quite well some of the epidemiological seasons like 2013 and 2016. In some epidemiological seasons, our model did not do quite well, especially in 2020. So in this particular case, there would be room for improving that model. So with this mention of how the usefulness of uncertainty in early warning systems, we finish our presentation for today. We'd like to acknowledge our colleagues of the Global Health Resilience Group at the Barcelona Supercomputing Center, and especially to researchers Rachel Lowe, Joanale Morano, Martin Lott, and Chloe Fletcher, who did some of the figures that you have seen in this presentation. Thank you very much. And I think we have 10 minutes for questions.
We do.
So,
okay. I have questions.
Yeah, absolutely. Let's go.
Okay. So someone asked how to set the prior distribution.
Yeah, so do you want to talk about it or?
I would just say use an uninformative word.
Yes, so it really depends on the model term. So I showed an example for the betas before we can go back to the presentation. It's before here. For the betas, which are the values of the coefficients of our climate covariates, one way that you can go, and usually it's a default, is to set what we call weakly informative priors, which are centered at 0. So we do not assume any directionality. They have large variability. So they don't actually give much information. They want allow the data to actually tell us the posterior. So we don't know that much. So we assume a very broad distribution and let the data lead us to the posterior rather than having some strong prior beliefs.
Okay. Here's a question. Can you share a link to talk about the reminder of the signification of the statistical term, which I don't really understand very well. So maybe.
Yeah, maybe I think maybe because here, since we're using Bayesian inference, so the term significance and p-values, we actually don't really use it because we have full probability distributions. So taking that distribution, you could compute an interval of the width you wish, for example, 95%, and see if that contains a zero. And that would probably be something similar to what you have in frequentist inference, but here we're doing Bayesian. So the term significance is a bit tricky, and we tend not to use it actually in this context.
Okay, here's a great one. So when modeling, after picking a data set to work with and picking a response variable, do you manually determine variable importance, or do you just throw all the variables and train the models? So I think this is a question about model selection.
I think so, yeah. We have
Yeah.
touched upon that.
Yeah. If there's a follow-up, or where CHAP perform variable importance. And then EDA tells us what to do at this point. And they're asking us to kindly share our workflow on this. So I think this is a question about model selection, and please, makate, if I'm wrong about that, please speak up or like correct me. So we haven't talked about that in this presentation. I think we're planning on giving a webinar at the Kigali conference where we will talk more about it, but I think we can maybe just summarize a little bit what we would do. Which basically what we do is first we kind of do it in steps. So first we look at which random effect so I'm sorry, I keep using that terminology. So which variables that absorb this uncertainty that is spatial, interannual, and seasonal kind of fit the best in our data. So we will try different formulations of those with different priors maybe, and just kind of compare those using goodness of fit metrics like WAIC and MAE. And then we'll just kind of choose the best combination of those. And then we move on to with those effects that kind of absorb that spatial temporal uncertainty, we start adding one predictor variable, and we test linear and nonlinear formulations of those and different lags of those. So say temperature, we would test linear and nonlinear lag 1, lag 2, lag 3, lag 4, lag 5, lag 6. And we would run all those models, and then we would see which ones fit better, again, with this goodness of fit metrics. And that would tell us kind of which lags are more important and if it's linear or nonlinear. And then using those, we would then test, like combine for all our predictors of interest, the best fitting lag and formulation. And then we would make combinations of those, and then we would see if the fit improves by including additional terms or predictors. So that's kind of the flow. Do you want to add anything?
No, I think
Okay.
that yeah, there's no written rules, and that's
Yeah.
how we
How
do
we
it.
do it.
We like
Yeah.
to combine like data-driven metrics, like Ansha mentioned, but also looking at the data, at the coefficients, and making if that makes biological sense, because we have knowledge about how these diseases work.
Okay. Then there's some interesting questions about, so how does the spatial model deal with regions where there are recurring changes in administrative areas? And I think the next question is maybe similar. So how do you consider community level factors like intervention, access to health facility, or community practice? And I would say if you have data on that stuff, you could include it as a predictor in your model. And if you don't, then that is part of the stuff that gets absorbed into these group level terms that are accounting for this variability that you don't know exactly where it comes from. So for example, if you're talking about community level factors or like administrative, area changes, those might be absorbed by your spatial term, right? Because maybe there's like some characteristics in the administrative unit that make, dengue go up or down in that administrative unit specifically. I don't know. Do you want to?
No,
Yeah.
I think that's correct.
Okay. What kind of machine learning approaches streamline the discussed processes and how would they compare in general?
Yeah, that's true. We didn't touch upon that because we didn't have time. So yeah, machine learning processes, well, as we mentioned in the last one, they have some advantages over that model selections because indeed they can fit more flexible relationships between the climate covariates, and then they could also potentially take into account all the spatiotemporal complexity that here we have to model explicitly. Some machine learning methods, if you set them up well, they could capture it. However, one critical aspect to take into account is the uncertainty. We need to make sure that we are quantifying the uncertainty of our output detections quite well. This is something that statistical models do very well. So you can also, and there is Bayesian ways to estimate machine learning models as well, especially neural networks. But the statistical model gives us the transparency into looking at what's actually happening in the data, which in an early warning system, where we're working with stakeholders, it's offers so much transparency and you can actually explain what the model is doing. So this is something very useful. And this is why we tend to default to statistical models.
Okay, DHS2 question that I can't answer. Can we get the source code for the presentation figures or examples?
Some of them, yes, those that I've made, definitely. Some of them are borrowed from papers when the figures
are cited.
They are cited, so you could go to those sources.
Yeah.
And yeah, if there's any specific figure you're interested in, you have the email in this presentation. You can just directly email us, and I will very happily send the code.
Okay. And unfortunately, I think we are at time. So I'm sorry we didn't get to this last question. But thank you all so much for your attention, for your questions. This was very lovely.
Yeah, it was amazing. Thank you.
And well, good luck with your modeling.
Yeah, good luck with your modeling. If you have our emails in case if you want to follow up on any of these questions. And yeah, take care.
All right.
Bye.
Have a great rest of your day. Bye. I know.